Welcome back to News 3 Today. As we continue to shine a spotlight on Mental Health Awareness Month, our focus this morning is on the mental health divide. According to the CDC, 1 out of 5 people are living with mental health conditions, which has increasingly become a focal point of concern. In marginalized communities, stigma is still a challenge, and when it comes to African American men, undiagnosed and untreated depression and mental illness continues to rise. Dr. Andrea Dickey is a licensed social worker and the founder and CEO of Therapy to Heal, LLC. She's also conducted a study on suicide in Black men. So much to unpack here. Thank you so much for being here this morning to talk about this very important topic.
Thanks for having me.
Well, first off, let's talk about Black communities, especially Black men and mental health. This can often be taboo.
It can be very taboo in the African American community. Seeking treatment, having mental health issues can be very taboo. And so as a result, Black men and Black women avoid seeking treatment. Mm-hmm. And ultimately what ends up happening is that African Americans really show a high result in seeking emergency mental health treatment because they wait so long in order to seek treatment.
And not only are they seeking treatment, but a lot of that treatment is unavailable to them.
Yes, as a matter of fact, it is so much unavailable to them as far as insurance is concerned. You have a shortage of mental health providers that are here throughout America. And so you have a huge challenge in this community seeking treatment and also accessing treatment.
Let's talk about some of the statistics, because I know you recently did a study on Black men and suicide rates and the fact that those numbers continue to grow.
They are very staggering. And actually it starts off, what I found, it starts off really early for Black boys. Mm-hmm. We're looking at between the ages of 11 and 14 that the suicide rates really begin to increase for Black males. And so you have a population who's actually not seeking treatment. It's stigmatized for them to have these symptoms or even talk about these symptoms, and then it becomes more and more pervasive as they move into adulthood.
So let's talk about some of the issues that are causing this. Why is that? Why is this happening?
Well, there's a lot of things that are happening. We're looking at psychosocial issues that are happening within the African American community. Black males are at higher risk to be impoverished or experience racialized issues that really target their self-esteem, which really triggers depression and anxiety issues.
Another issue worth exploring is to take or not to take medication. That's a big deal.
Oh, that is a huge deal in the African American community. And that really comes from the history of research and using African Americans as they would call test dummies. Mm-hmm. And so a lot of times as African Americans, we are fearful of the medical community and how it will affect us.
So you created something called hip hop therapy intervention. Let's talk about that.
So I actually did not create the intervention. So the intervention actually, Dr. Edgar Tyson, who is a social worker, began to research hip hop music being used in mental health back in 1998. I was just, I've been a social worker for 20 years, and I began to read on it and really saw how effective it was in my interventions as I practiced. And so what I have found in research is that there are not a lot of research interventions that really focus on this community, and there's not a lot of interventions that mental health providers can actually use. So this research study really gives an outline of what a hip hop therapy intervention can actually be used for.
Talk about Therapy to Heal, LLC. Now that you did find.
I did find that. I did find that. And that came out of my passion for really seeking and helping mental health professionals learn cultural cultural diverse interventions. And so hip hop therapy, so what I actually do is I do interventions. I go into schools, I go into nonprofit organizations and do events for youth and young adults, really showing them that therapy can really be fun. It can be a tool for self-improvement. I also facilitate continuing education courses and for mental health professionals.
Okay, so that wraps up our time right now, but for more information on what you do, they can find it on our website in this interview at WSAV.com. Thank you so much for joining us today. We look forward to speaking with you about many other issues.
Absolutely. Thanks for having me.
Thank you. Stay with us. We'll be right back with a final check of your forecast.